Hello guys, so now we shall be discussing regarding the regions of the abdomen. Okay, so our topic of discussion will be regarding the regions of the abdomen. So regarding the regions of the abdomen, what are the different kinds of regions in the abdomen you have got? Okay, so first of all, before I discuss the regions of the abdomen and tell you what organ is located in each and every region, first of all I'll just draw the regions of the abdomen. Okay, so let us say that this is your body wall surface. Okay, this is your body wall surface, and all of you know that here you have got your diaphragm. This is your diaphragm. Okay, and here you know you have got your inguinal region, the right inguinal ligament as well as the left inguinal ligament. Now this center part, whatever is there here, this is called as the abdomen. Now this abdomen, right, is divided into 9 boxes. Okay, so that is why you call this abdomen as a Pandora's box. Why you call it as a Pandora's box? In the sense, every time when you open the abdomen gives you a new diagnosis. For example, let us say a patient is complaining of let us say right inguinal pain. Okay, very severe right inguinal pain, mainly the younger children, for example, let us say, or let us say at a 50-year-old male is complaining of right inguinal pain. So what we think that it might be appendicitis, right? But when we cut open and see, there might be a different pathology there. Along with appendicitis, there might also be, let us say, cecal cancer also can be there, right? So but whatever it is, every time whenever you open the abdomen, there are many chances that you can find out a new diagnosis. That is why it is a surprising box or Pandora's box. Okay, so you divide this abdomen into 9 regions. Okay, so like this. So simply you divide this abdomen into 9 regions. So upper 3 stories are there: upper story, middle story and lower story. Upper story has got 3 boxes, middle one has got 3 and the lower one has got 3. The middle one here we have got the umbilical region. All of you know that, right? So now let us name these regions and then we shall write down the organs that are located in these regions. So all of you should know that this region is called as a epigastric region. This is called as epigastric region. And this region is called as the mesogastric region. Epigastric, mesogastric. And next one is called as a hypogastric region. Hypogastric region. Okay, and this one over here is called as a right hypochondriac region and left hypochondriac. See, this region over here is called as a right hypochondriac region. Why are you calling it as right hypochondriac region? Because it is on the right side. Why are you calling it as hypochondriac? Hypo means below, chondric means ribs. So this region is present below the ribs. In the same way, the same region that is present below the ribs on the left side is called as left hypochondriac region. Left hypochondriac region. Okay, in the same way, this region over here is called as right lumbar region and this region is called as left lumbar region, and this region over here is called as the right iliac fossa. Right iliac fossa, and this region over here is called as a left iliac fossa. Why should we know these regions? Because tomorrow patient will come and tell the doctor, I have pain just beneath my breastbone over here. So what is this region called as? Epigastric region. He will tell doctor, I have pain beneath my ribs on the right side. What is this region called as? Right hypochondriac region. So if you know what organs are located in this right hypochondriac region, it will be easier for you to diagnose the condition. So on the right side, what do you have? You have got liver. On the left side, what do you have? You have got spleen. In the epigastric region, what do you have? You have got your stomach, you have got your pancreas and all. Okay, so and so forth. If patient, let us say a patient is complaining that doctor, I have very severe pain in the right inguinal region. In the right inguinal region or right iliac fossa, both of them are same. Okay, in the right iliac fossa or right inguinal region, what do you have? You have got appendix. So mostly it will be appendix, but still the pain will be different there. Okay, and we have also got some different signs or things which you do. I'll talk about those things later on. But right now, what we have to draw is that right hypochondriac region, what organs are there and all, everything in each and every box here we shall discuss now. Okay, so first what we shall discuss is right hypochondric region. In the right hypochondric region, what are the different organs we have got? Right hypochondric region. So in the right hypochondric region, we have got different organs. For example, in the right hypochondric region, what do you have? You have got liver and the gallbladder, right? So what I will do is that, guys, some of the organs I'll just draw it over here so that it will be better for you to understand, right? So if you can see here, see, this is the liver like this. Where is the liver maximum located? I'm not telling liver is completely located in right hypochondric. It is also little bit projecting into epigastric also, right? But mostly it is covering the right hypochondric region. So liver is located in the right hypochondric region. Now behind the liver, what do you have? Gallbladder. So I should also write that gallbladder is also located in the right hypochondric region. Yes or no? Next important thing is called as epigastric region. Epigastric region. Epigastric region. So what are the things that are located in the epigastric region? In the epigastric region, you have got three important things, right? For example, so let me draw this part over here. Yeah. See here, this part which I am drawing right now is your stomach. This part which I am drawing right now is your stomach. Okay. Now behind your stomach like this, and in the loop of duodenum, all of you know this is duodenum, and in the loop of duodenum you have got the head of the pancreas and the body here, and you see behind the stomach there is complete pancreas like this. Okay. Now if I am dividing the regions like this, I am telling you that this region is epigastric region. Epigastric region. Okay. Epigastric region. So this is called as your right hypochondric, right, and this is called as your left hypochondric region. Right hypochondric region, left hypochondric region. So exactly in the center, what do you have? You have got your stomach, you have got your pancreas as well as the duodenum. Okay. So you have got your pancreas, you have got your stomach, you have got your duodenum. You have got your duodenum. Okay. Now after the right hypochondric epigastric, the next region we have is the left hypochondric region. So what are the structures that are located in the left hypochondric region? So structures that are located in the left hypochondric region. Again, what I will do is that let me draw this part. This is the abdomen here, right? So I already told you I divided the abdomen into three different parts like this. Completely 9 different parts. Okay. So we are done discussing the right hypochondric region. We are done discussing the epigastric region. Now what is present in the left hypochondric region? In the right hypochondric region, I told you, what do you have? You have got your liver. Now in the left hypochondric region, you have got this part, and this is called as your spleen. What is this? This is called as your spleen. And not only the spleen, remember one very important thing, that this colon which I am drawing right now is your ascending colon. Okay. And after that, this colon which I am drawing right now is your transverse colon. And after that, this colon which I am drawing right now is your descending colon. Now exactly here, if you see this corner and this corner on the left hand side, on the right hand side, this is called as hepatic flexure. Okay. So hepatic flexure. Okay. And this corner which you have on the left hand side here over the spleen here, this corner you call it as a splenic flexure, because there the spleen is located. Okay. So what are the two important things you got in the left hypochondric region? The first one is your spleen. You have got your spleen, and you have also got your splenic flexure. Splenic flexure. Okay. So these are the three important things. So we have actually covered the right hypochondric region, epigastric region, as well as the left hypochondric region. Now next we shall go on to the right lumbar region. In the right lumbar region, what are the things you have got? Right lumbar region. Now in the right lumbar region, if you see here, guys, this is the border, right? This is the border over here, and I'm drawing the lines like this. Where is your right lumbar region? So this one over here is your right lumbar region, and in the right lumbar region, what do you have? All of you just look at this. We have got our right kidney in the right lumbar region. Now along with the kidney, you also have got, what is this structure which is coming down? This is called as your ureter. So along with the right kidney, you have got your ureter. And from the previous picture, I told you there is a colon that is going up. What is this colon? Yes. What is this colon which is ascending up in this way? Yes, what is this? This is called as your ascending colon. So three important structures you have got here. So this is your kidney, this is one important structure, and second important is your colon over here, and third important structure over here is your ureter, So three important structures. What are they? So one is called as your kidney. Now which kidney? Right kidney or left kidney? This is right kidney. And you have got your right ureter. Okay, and you have also got your ascending colon, So these are the three important things that you have got in the right lumbar region. Okay, now after that, moving on to the next important region, that is your mesogastric region, or the other name for this mesogastric region is umbilical region. So what are the structures we have got in the umbilical region? Right. So what are the structures we have got in the umbilical region, guys? Umbilical region, or you can call it as mesogastric region, umbilical region or mesogastric region. So what are the important things we have got here? So again, let me draw the picture over here again. So this is your abdominal wall. So if I divide this, so this center one is called as the umbilical region or the mesogastric region. Now here what do you have? Here I already told you, you have got your stomach like this, right? In the epigastric region, not only stomach, another, what is the thing? This is the duodenum also which is present, right? And after the duodenum, what do you have? Jejunum. So this is the jejunum like this. You see, this part is your jejunum. And after the jejunum, what do you have? You have got your ileum. So this part over here is called as your ileum like this. Yes or no? So if I shade it for you, so this part from here all the way, right? So from here all the way, let us say till here. Okay, so this blue color part which I have shaded right now is called as your jejunum, and this yellow color part which I am shading right now all the way from here till here is called as your ileum. So can I tell the entire loops of small intestine are located in the mesogastric region? Yes. Apart from that, if I remove this part behind this, I have got two important vessels. What are those two important vessels? See, behind this I can see a branch that is coming down, right? What is this branch? This is called as an aorta. In the same way, I can also see a green color branch that is coming down. What is this green color branch? This is called as inferior vena cava. So there are two important things: a red color branch called as aorta, a green color branch here called as inferior vena cava, and the small bowel loops or the small intestines. Okay, so these are the structures which I have got over here in the umbilical or the mesogastric region. So what can I write here? Loops of small intestine. Okay, next we have got the aorta. Next we have got the inferior vena cava. These are the three important structures that are located in the umbilical region. Now after that, we shall move on to the next region, that is called as a right lumbar region. So what are the structures that are located in the right lumbar region? Right lumbar region. So again, so if the lecture is lagging, I want you to just fast forward this, okay? Because my main goal is to teach you easily with very much details over here. Repeat. Again, let us start from the basics. So starting from the basics is really very important. So if you feel it is lagging, you can just fast forward it. So again, the same important thing over here. So you know that this is the mesogastric region. Let us put some room for this left lumbar region. Okay, so we are done with these three. We are done with the right as well as the center one, that is epigastric region. And now here we have got another important thing, that is we have got a ureter like this. We even have got a kidney. We even have got our kidney, right? And from this picture, if you see, what is this colon over here? This is called as your descending part of the colon, right? So let us say this is your descending colon. This is your descending colon. So let me highlight the structures. So these are the structures over here. You see, one is called as a descending colon over here, and the other one over here is called as your kidney, and the next one over here is called as your ureter. So these are the three important structures that are located over here. What are these three important structures? The first important structure is the left kidney. Second important structure over here is called as your left ureter. Third important structure over here is called as your descending colon. Descending colon. So there are three important structures collectively which you have got here. So what are those three important structures? One is called as your left kidney, left ureter, as well as a descending colon. So there it was in the right lumbar region, right kidney, right ureter and ascending colon. Here it is left kidney, left ureter and descending colon. Okay. So we are even done with this part, that is the right lumbar region. Now let us focus on the right iliac fossa. In the right iliac fossa, what are the structures you have got? In the right iliac fossa, what are the structures you have got? So let us make the body line like this. Right. All of you know that we have got one important structure over here. What is this? This is called as your cecum. And to the cecum, what is the structure you have got? You have got appendix. And after that, you have got this ascending colon. So I am just highlighting the cecum over here. So this part which you can see here, this is your cecum, and this blue color part which I am highlighting right now is your appendix. Cecum, as this little finger like projection, is called as your appendix. Now if I ask what are the structures that are located in the right inguinal fossa, what are the two structures? One is called as your cecum, right, and the other one is called as your appendix. Cecum as well as the appendix. These are the two structures that are located in the right iliac fossa. Now let us look at what are the structures that are located exactly here. What is this? This is your hypogastric region. Now if you look at the hypogastric region, what are the structures that are located? Right. So all of you know this important thing, that here we have got the loops of intestine, all of you know, right? We discussed about jejunum as well as ileum, right? So this is the jejunum part, and from here I am drawing the ileum. So this will be the ileum, but I will highlight it later. So this is the ileum part like this. Okay, and finally the ileum joins with what? Your cecum having this appendix. So this is the picture which all of you know. Right. So from this part all the way, this is your jejunum, let us say. From here till here, this is your jejunum. And from here all the way, you have got your ileum. So let us say that this entire part is your ileum. Okay. Now, in the hypogastric region, what do you have? You have got the small intestine bowel loops. Whether it might be jejunum or ileum, sometimes both of them will be there. Right, let us not discuss in detail, but overall you know that in the small intestine, in the hypogastric region we have got ileum, but in the textbooks it is given that loops of small intestine, it is written there, which means both ileum as well as jejunum. Okay, but here as per the picture which I have drawn, it is only ileum. So you have to follow the textbook, so just write it down as loops of small intestine. Now apart from that, don't you think that you have got another important structure like this? What is this structure which I am adding upon this? This is your urinary bladder, right? Now in the females, what do you have in this place? You have got urinary bladder obviously, but you also have got uterus. Now normally urinary bladder and uterus, are they present in the hypogastric region? No. So when uterus is enlarged, when urinary bladder is distended, in these two cases only, the organs they distend up. Okay, so let us say if this is urinary bladder or uterus, when they distend up, will they distend side to side? No, they will distend in this way. They are distending upward in this way. They are distending like this, right? So let us say this is hypogastric region. So this is below that. Now when it is distending up, it is entering into the hypogastric region, right? So that is what I am telling you, that when I write it, you will understand it, that hypogastric region is having coils of small intestine. Okay, it is also having urinary bladder. So when can you visualize the urinary bladder? You can visualize the urinary bladder only when if it is distended. Okay, and third important thing which you have over here is uterus. When can you see the uterus? You can see the uterus only if it is enlarged. Now tell me the condition where the uterus will be enlarged, guys. That is most commonly seen in what? Pregnancy, right? And finally we have got the left iliac fossa. Now we have got the left iliac fossa. So right iliac fossa is finished. Now we are coming on to the left iliac fossa. So in the previous picture only I will show you. All of you know that over here we have got descending colon. I hope by this time you are perfect with this. This is descending colon, right? So descending colon is coming all the way, and after that this S-shaped colon which you have here is called as sigmoid colon. So in the left iliac fossa, what do you have? You have got your sigmoid colon in the left iliac fossa, right? Sigmoid colon. So now let us recap all the structures which we have discussed, guys. I started the discussion with the first region, that is called as the right hypochondriac region. So this region over here is called as your right hypochondriac region. Okay, you know what are the structures that are located, and after that we have got our epigastric region, and finally we have got our left hypochondriac region. Now in the right hypochondriac region, what do you have? Without looking at the picture, just tell me. You have got the liver, you have got the hepatic flexure, you have got the gallbladder. In the epigastric region, what do you have? You have got the stomach, you have got the pancreas, you have got the duodenum. In the left hypochondriac region, what do you have? You have got the splenic flexure and you have got the spleen. Now hanging on to the next important thing. Next important thing in the sense, let us say, what are the structures that are located in the right lumbar region? In the right lumbar region, what do you have? Yes, you have got your ascending colon. Okay. Now when it comes to the left lumbar region, right lumbar region, you have got ascending colon, you have got right ureter also, and right kidney. In the left lumbar region, what do you have? You have got left descending colon. See, there it is ascending, here it is descending. Descending colon you have got what? Left ureter attached to that left kidney. Right? In the mesogastric region, what do you have? In the mesogastric region, you have got small intestine, large intestine, bowel loops, isn't it? Right? Now coming to the right iliac fossa. In the right iliac fossa, what are the structures you have got? You have got cecum and appendix. In the left iliac fossa, what do you have got? You have got your, just now we discussed, you have got your sigmoid colon. And in the hypogastric region, again, what you have got in the hypogastric region? Uterus if distended, uterus if enlarged, urinary bladder if distended, and also small bowel loops. So these are the parts here. Now why am I telling you this is that, for example, tomorrow in your hospital, if a patient is coming to you complaining that, doctor, someone stabbed me with a knife in my right hypochondriac region. Now this is just a hypothetical question, because no one will come to your hospital with an injury, knife injury there. So he will be brought to the hospital, rather he alone coming to the hospital. Okay, right. So let us say you have seen in an emergency department, it is your duty, you went there, you have seen a knife that has deeply penetrated into the right hypochondriac. Now when the knife is here, will you tell patient's descending colon is damaged? No, you won't tell like that. Will you tell patient's urinary bladder is damaged? No. So in the right hypochondriac region, what do you have? Liver. So there might be rupture to the liver. So in the left hypochondriac region, what do you have? Spleen. There might be rupture to the spleen, right? So obviously whenever there is a rupture to the spleen, the surgery which you do is called as splenectomy. How do you do splenectomy? For example, let us say a patient is coming with rupture of spleen. Okay, organs rupture, right? So there is rupture of spleen. Rupture in the sense there is breakdown of spleen. So whenever there is rupture of spleen, let us say you have hit the person, you have stabbed the person with the knife. There are 5 different grades of splenic injury. First grade, you don't do anything, it is normal. Second and third grade, it is mild. Fourth and fifth are very severe. So in these cases, you need to do splenectomy. What you need to do? You need to do splenectomy in these patients. Okay. So these are some of the important things which we have discussed regarding the hypochondriac regions, guys. So this is all regarding this regions of the abdomen. So thank you so much for watching my video. Goodbye.